Rodney Paget here. I'm a local veterinarian in Bluntville, Tennessee. I'm going to show you a demonstration of how lobbyists double talk. And today's lobbyist in particular that I'm going to show you is in regards to HB0164. It is a couple of Tennessee Chiropractic Association lobbyists. The lady here is Tiffany Stevens. She's the executive director of the TCA, and the gentleman is Dr. Richard Cole. He is the vice president of the TCA. I'm going to just show you a brief comment that she's going to make here about there not being guidelines in place. And then I'm going to let him give his talk, and I'm going to break in a couple of times to point out some different things that he says. And then I'm going to play a section from about 2.5 minutes after he finishes, where he basically contradicts everything he says completely. And as far as what this bill is about, HB0164 is, as you can see over here to the right, was a caption bill that was to reduce the amount of time that the veterinary board had to respond to applications from 60 days to 50 days. However, again, as a caption bill, meaning it was just a placeholder because the true intent of what they wanted to do either wasn't ready or wanted to be hidden for a while. So when it comes to committee in early March, they brought the amendment, and the amendment is basically to allow chiropractors to be portal of entry providers of healthcare for animals, even though animal chiropractors with the certification that they're talking about have only taken about 200 and something hours worth of training compared to the 4,000 to 5,000 hours that comes with veterinary training. They want to be portal entry providers, even though they're not qualified to do the diagnostics required to make sure that an animal is going to be able to be safely treated with chiropractics, or that it's going to be a benefit, because there is some questioning on just how beneficial it is in animal medicine anyways. But that's neither here nor there. I would encourage you guys to go watch some James Chilelli DVM YouTube videos if you have questions on why chiropractics can be a little bit iffy in animals. He's a board certified veterinary neurologist who deals with, of course, spinal and nerve injuries and in animals. And so he's got several videos that will show you chiropractors putting dogs in situations that they shouldn't be put in. So here's this speech from these two.
It should be noted, while care to animals have been given for years, this certification has been around since 1989. It was stated previously that we are here today because there has not in Tennessee been a definitive to make clear lines to protect both professions. That is what we believe this bill does. We ask for your support on this bill today. Thank you for your time.
So what she's saying there is that in some ways she's right. There aren't definitive clear lines as far as protecting like who gets malpractice charged if the chiropractor does something wrong to the animal. As of right now, these guys will like to tell you that chiropractors are working on animals, and that this raises the bar to where they have to be certified for animal chiropractic. It's an interesting argument. It's kind of like an amnesty argument with illegal immigrants. Chiropractors are not supposed to be doing veterinary medicine, and chiropractics is within the Veterinary Practice Act as a alternative or type of medicine that is under our umbrella. So the fact that the chiropractic board is not doing its duty as given within its own statutes to reprimand its chiropractors for practicing outside of their license, they seem to think that lack of actually the chiropractic board doing its duty is actually a reason to put the whole process under the chiropractic board and allow them to become certified and do chiropractics as a portal of entry. So it's a really backwards argument. They say it's been going on for a while, and this prevents it from happening unless they're certified. Yet, if it's been going on at all, it's both a Class B misdemeanor under the veterinary statute, and it's a valid reason to reprimand a chiropractic's license if they've been doing it. Crazy argument, but that's one that they do make multiple times within the committee hearings. Now, moving on to Mr. Cole, and I can reference anybody who wants to reach out to me. I can reference the statutes for what I'm saying. Mr. Cole is going to talk to you here now, so I'm going to let him speak.
Thank you, Ms. Stevens. And Mr. Cole?
Hey, I'm Dr. Richard Cole. I'm Chairman Todd. Thanks a lot for letting us be here today, and thank you for the committee for letting us talk to you. I'm from Memphis, Tennessee. I'm the Vice President of the Tennessee Chiropractic Association, and I speak in favor of the bill today. There's two salient points, in my opinion, on this bill. One is a public protection initiative, and the second is a freedom of choice for the owners. Regarding public protection, this bill establishes competency standards for veterinarians and chiropractic physicians who wish to provide chiropractic services to animals. The American Veterinary Chiropractic Association, which is the AVCA we've been talking about, has been identified by U.S. jurisdictions and international organizations as an entity best suited to prepare vets and chiropractors to provide chiropractic services to animals. We ask that the committee raise the standards for veterinarians and chiropractors who wish to provide services to animals and require this certification. Regarding freedom of choice, chiropractic services for animals continues to grow in popularity, and many owners wish to provide these healthcare services to their animals. This bill will allow animal owners the right to make the decision, a valued decision, regarding what's best for their animals. Chiropractors are physicians with broad diagnostic capability and differentially diagnose our patients on a regular basis. The same diagnostic capability rests with chiropractic physicians treating animals. AVCA chiropractic.
So I'm going to stop it here. So the freedom of choice thing he's talking about, and also the sponsor, Marsh, will mention that animals are property and that the owners shouldn't have to be required to take their property, somewhere that they don't want to. And you kind of get the same side of the argument with this gentleman here. But animals are property, but they're not exactly property because they are still living beings. And just as you have animal abuse laws out there, if you don't feed your animal or if you don't water your animal, if you don't provide them appropriate shelter, they're not equivalent to the old rusty tractor that you can just let sit out in the field and rot. So, I don't know that there's exact argument there. That's not an apples to apples scenario. So I don't understand why they think it's okay to take an animal to a person that is unqualified. Yes, they have 200 and something hours of this animal chiropractic training through the AVCA that he's advocating for, but it does not equate to a 4-year degree in veterinary medicine. And they like to use the fact that they're physicians and they had a 4-year degree, but their degree was in human medicine. And this gentleman, a couple of different times in committee, has said, well, the first thing I did when I learned to be a doctor was dissect a cat. Unfortunately, that doesn't make every 8th grade student in the country qualified to be a veterinarian or a marine biologist because they dissected a dog shark or something. So, it's a very bad argument. I'm going to let him keep going here. What I want you to pay attention to here, though, is he's going to talk about the AVCA and how its standard of care requires that an animal be current with a veterinarian. And by current with a veterinarian, they're going to imply, like current with vaccines and that they've been seen yearly and that sort of thing. But when it comes to an illness, you're only current with the veterinarian if they've seen the animal for the illness that is being, evaluated, I guess you could say. So if the animal came up with lameness or hunched up posture or something like that, if the veterinarian has not seen that animal for that process or that disease process, then they wouldn't be able to quote unquote treat them. Therefore, if they go to a chiropractor, they're not current with the veterinarian because they haven't seen them for the problem the chiropractor is seeing them for. So I think there is some hairs to be split on the definition of what standard of care here is. And then I'm going to show how he talks about, the animal should be current with a vet, which to me would mean that it needs to be referred to a chiropractor. If that's deemed safe and beneficial by the veterinarian. And then I'm going to show where he completely blows his own commentary up just about 2.5 minutes later in a question and answer with one of the representatives.
Chiropractors with the additional training to differentially diagnose will be evaluating the animal and referring as needed to ensure the animal is getting the proper care that they need. This bill would require certification by AVCA, which would be in the best interest of the animal. Current AVCA standards of services require that the animals be current. The standard of care for AVCA practitioners requires that the animal be current with their veterinarian before the chiropractor would treat them. This allows another level of protection for the animal by chiropractors being in the market, evaluating animals, and ensuring that all animals are seeing their veterinarian on a regular basis. In reality, AVCA certified chiropractors desire to work closely with veterinarians in practice. They will. They have for many years, and this bill will allow them to continue to do so as we reach into the future. Thank you very much for your time.
So before I fast forward this, when he says they've worked with them in the past, there is some truth to that. Veterinarians have referred animals to animal chiropractors in the past, and under veterinary referral or supervision, with current language, it's most likely that would be protected. Where they get into troubles where you have chiropractors that are practicing on animals without veterinary supervision or direction. And that's been allowed apparently to go under the radar. And these guys feel like that because it's been allowed to go under the radar that they should be basically exempt. We have put out amendments to this to ask for it to be based on referral from veterinarians, but they have fought that because when it comes right down to it, this is a revenue stream for them. This is being able to get an animal in and provide treatments on it, maybe or maybe not with an adequate diagnosis. And in subcommittee, he mentioned taking x-rays. There's nothing in this language that would indicate that they should be able to take x-rays because that is part of traditional veterinary medicine. Again, the Veterinary Practice Act definition for practicing veterinary medicine would incorporate that within it. But who knows what they'll be allowed to do in the current state of affairs and the way the legislation has been letting this roll through. The argument is that if you go see the vet and then they refer you to chiropractic, you're having to pay two fees. Interestingly enough, the chiropractors will say, well, if it comes to us and it's not a chiropractic issue, we'll send it to the veterinarian. And again, there's two fees. So the argument is just mundane. I'm going to fast forward this here to about the 44:30 mark and let you listen into a Q&A from Representative Shaw with this gentleman.
But I went to her first. I had to pay her. So I don't know why money is the issue here when we want the best for our animals. Can you answer that question?
Thank you, Representative Shaw. I appreciate you very much. That's an excellent question, and here's the way we'll answer it. Chiropractors are portal of entry healthcare providers for humans right now, and we're asking for you to allow the animals to be allowed to see the chiropractor as a portal of entry healthcare provider as well. We diagnose patients every day in our offices, and we send them to cardiologists and GI doctors and different doctors on a regular basis. And animal chiropractors do the very same thing. They diagnose the animal, they find out what's wrong with it, and they refer the animals to the veterinarian that need advanced care or medicine or surgery. Representative Alexandra had a great point earlier when she talked about the anterior cruciate, or the Dr. Marion. The anterior cruciate tear is an easy diagnosis for a doctor that's trained in veterinary training, and also for chiropractors that are trained in veterinary diagnosis, because that's an easy diagnosis. You don't have to have an x-ray machine for it. Actually, x-ray machine just tells you if the joint structures are intact, but the ligaments don't show up on x-ray. So it's a physical.
So he'll go on to talk about how they would refer a patient like that to veterinarian or straight on to the specialist. But let's break down what he just said here. Did you hear him say that the intent of this bill is to make chiropractics a portal of entry provider for veterinary care? That is what they want. That is why they fight against us asking for it to be based off of a referral, which is the appropriate best medicine way to do it. It also, interestingly enough, says that if they pass this bill and become a portal of entry provider, that the first time that they see a patient without a veterinary referral, they are violating the standard of care of the certifying body that he just talked about 2 or 3 minutes ago in the American Veterinary Chiropractic Association, where it says that animals should be current with its veterinarian. Standard of care is that they be current with their veterinarian prior to chiropractic. So in passing this law, the very first thing they're going to do is violate certification standard of care the first time they see a patient that is not sent to them by a veterinarian. And I don't think a single legislator has brought that up or tagged that yet to say, like, hey, what you're asking for violates what you're saying that you're wanting to raise the bar to. But anyways, that's point number one, and that's probably my biggest point. Point number two is he's talking about an anterior cruciate ligament tear here, and it being an easy diagnosis. And this is just another instance of these guys having the Dunning-Kruger effect or an ego or whatever. But he says it's an easy diagnosis. It can be an easy diagnosis because some dogs will completely tear their cruciate, and they will have a cranial drawer sign that is very obvious on physical exam. What he doesn't mention is that some dogs will partially tear their cruciate ligament and they will not have a cranial drawer, and they will have a very suspicious looking gait. They may have actually some changes on x-rays, like older arthritic changes from a previous partial tear, or they may, which would be things like osteophytes on the edges of the bones. They may have intracapsular soft tissue swelling that's behind the patella tendon that will be evidence of joint swelling that would indicate an acute trauma there. But some of these dogs would need to be referred to a specialist to be evaluated with a CT scan, even potentially. Or the other thing that happens is a lot of the really heavy fat dogs, or very nervous dogs, or anxious dogs that are bitey, that sort of thing. A lot of times they're so tense, and because this is mostly a big dog issue, they're so tense that you cannot feel the cranial drawer instability in them, even if they do have a pretty significant tear, because they're able to tense those muscles up so much. And so you have to actually put them under a chemical sedation or even all the way on with anesthesia to be able to feel that cranial drawer sign and confirm that diagnosis, which that would be something that a chiropractor would not be able to do. So if they missed that cranial drawer and treated them time again and time again and time again with their chiropractics, they would be delaying the animal potentially a needed surgery. So again, just like in the health committee where he talks about how splenic tumors are super easy diagnosis because the chiropractor could easily look at the spine and see that it wasn't out of malalignment and know that it was an internal disease. That is complete and total male bovine excrement. And again, just the instance of where they don't know what they're talking about, and why they're so dangerous that we are breezing this legislation through unfettered through our General Assembly. And it's time that you pay more attention if you're a legislator. But anyways, battery's getting low. I'm going to get off. I hope that this was helpful. Thanks.